A local hospital is one of the first in the nation to offer a procedure for an incredibly painful and, well, somewhat embarrassing condition. Doctors at Foundation Surgical Hospital helped 2 patients with an abnormality in the pelvis.
Now, let me see you step up and down on your toes. Up and down, up and down. And is that going okay without triggering the pain?
At first, Julia Vanderlaan couldn't find anyone to help her unbearable pain.
I went to probably a different doctor every couple weeks, every month. Everything from neurologist, gynecologist. I went to doctors that thought maybe it was bladder cancer, but then they realized it wasn't. A urologist, I guess. Regular MDs.
Nobody knew.
Nobody.
Finally, she found a source online that led her here to Foundation Surgical Hospital. Doctors quickly diagnosed her with a problem called pudendal nerve entrapment.
We're looking at the inside of the pelvis, at the wall of the pelvis. This is the pudendal nerve where it comes out of the spine in the sacrum. It runs along the outside of the pelvic wall and passes between 2 ligaments.
Finally, Julia knew this is the source of her pain. At the worst, what was your pain like?
Unbearable, where you just really don't want to live. And that's just being brutally honest.
Nobody wants to live like that.
Mm-hmm.
So it's like a stabbing, just horrible pain.
Stabbing, burning, like electric shock, fire ants. Excruciating.
It's a lot to take.
Mm-hmm.
How long had you had your symptoms before surgery?
No one knows for sure what causes a problem. Doctors think it could have been childbirth years before for Julia. For Timothy Raines, it was probably extreme exercise.
I had just finished riding 4,000 miles within a 24-month period, a couple thousand miles a year averaging.
And how about running?
I just finished 500 miles of running that year, and I would have ramped that up a little more as I was approaching the 08 Houston Marathon.
Are you able to bend down and touch your toes?
Oh, yeah, absolutely.
But when the pain hit, it was so sudden and severe, Timothy knew his athletic lifestyle was over forever.
And began feeling a mild sensation like you've just started heating up a curling iron on my right glute. It's in the absolute the crease of where the glute and the leg kind of meet. On the inside in the perineum. So you've turned it on, but it's nice like on warm or something. And every maybe 5 minutes that goes by, that gets hotter and hotter.
Timothy and Julia both underwent a procedure to help lower their pain level.
What we do at surgery is cut these 2 ligaments. They're structures that are no longer necessary. And then we shift the nerve in front of this process so that we actually add slack to the nerve. That way they can sit without drawing on the nerve.
There's no cure for the pain, but it's definitely gotten better for both patients. They agree they feel about 50 to 65% better.
This is my Life-Form Travelite seat cushion that I carry around with me wherever I go. It draws a lot of interesting conversation from passersby and my coworkers. Basically, this is what gives me the ability to sit.
But not for long periods at a time. Julia sits on an exercise ball. Both can sit for less than an hour before pain forces them to stand many hours of the day. Still, they're relieved to get some help from surgery.